Welcome to StudyNeuro. In this presentation, we'll cover postoperative care after posterior communicating artery aneurysm clipping, with emphasis on ICU management, complication monitoring, and vasospasm prevention. We'll review the immediate priorities after surgery, including neurological assessment and stabilization, because early postoperative changes can strongly affect patient outcomes. Close intensive care unit monitoring is essential. Next, we'll discuss important complications that may occur after clipping, such as hydrocephalus, seizures, electrolyte disturbances, and delayed cerebral ischemia. Vasospasm is especially important. It can reduce cerebral blood flow and lead to secondary brain injury if not recognized early. We'll also explain the main strategies used to prevent and manage vasospasm, including careful hemodynamic support and medical therapy, with endovascular treatment considered in severe cases. Finally, we'll outline the importance of rehabilitation and long-term follow-up, since recovery after aneurysm surgery often continues well beyond the immediate postoperative period. Join the StudyNeuro community across social media for more high-yield neuroscience education, clinical insights, and neurosurgery updates on YouTube, Facebook, TikTok, Instagram, and X. Posterior communicating artery aneurysm clipping is a critical neurosurgical procedure performed to prevent or control life-threatening intracranial hemorrhage. The surgery secures the aneurysm from the circulation, but patient outcome depends just as much on what happens after the operation as during the procedure itself. Postoperative care is essential. Patients require close monitoring because neurological status can change rapidly during the early recovery period, especially after aneurysmal subarachnoid hemorrhage, where complications such as vasospasm, hydrocephalus, or delayed ischemia may still develop despite successful clipping. This presentation focuses on the key goals of postoperative management, including immediate stabilization, early recognition of complications, and support for long-term neurological recovery. Proper postoperative care can significantly improve functional outcome and overall survival. After clipping of a posterior communicating artery aneurysm, the patient is transferred directly to a neurosurgical intensive care unit. This is a high-risk period. The neurological state can change quickly, so continuous monitoring is required from the moment the patient arrives. The immediate priority is stabilizing basic life functions. The airway is secured first because adequate oxygen delivery depends on it. Breathing is then assessed and supported to ensure effective ventilation. Circulation is stabilized to maintain consistent blood flow to the brain, especially during this vulnerable postoperative phase. After initial stabilization, attention shifts to maintaining physiological balance. Oxygen levels are kept within a safe range to protect brain tissue, and blood pressure is carefully controlled to preserve cerebral perfusion without causing additional stress on recently treated vessels. This phase is managed closely because even small changes can worsen neurological injury. Immediately after posterior communicating artery aneurysm clipping, an early neurological assessment is performed. This is not delayed because the first hours after surgery often determine how quickly complications are recognized and treated. Early evaluation is essential. The assessment focuses on basic neurological function. Level of consciousness is checked using the Glasgow Coma Scale. Pupil size and reaction to light are examined, and motor responses are tested in all limbs to understand how well the brain is functioning after the procedure. These findings are used to establish a baseline neurological status for the patient. That baseline is important because any later change can be compared against it, allowing clinicians to detect deterioration early and respond before irreversible injury develops. After posterior communicating artery aneurysm clipping, continuous monitoring becomes a central part of care. The patient is observed closely because neurological and systemic changes can occur suddenly during the early postoperative period. Constant vigilance is required. Vital signs are checked regularly to ensure the patient remains stable. In selected cases, intracranial pressure monitoring is used to track pressure inside the skull, especially when there is a risk of swelling or secondary brain injury. Alongside this, repeated neurological examinations are performed to detect even subtle changes over time. Care teams remain alert for early warning signs, such as a drop in level of consciousness or the appearance of new focal neurological deficits. These changes can signal complications that need immediate attention, and early detection is often what prevents long-term damage. After posterior communicating artery aneurysm clipping, fluid and electrolyte balance becomes a key part of postoperative care. The brain is sensitive to even small changes in sodium and fluid status, so careful tracking is essential from the start. Strict input and output monitoring is maintained to understand the patient's fluid bands in real time. Sodium levels are checked regularly because they can shift quickly after neurosurgical procedures and affect brain function if not corrected early. Small changes matter here. The main concern is detecting low sodium early. This condition can develop in the postoperative period and may worsen brain swelling or neurological status if missed. Early recognition allows timely correction and helps prevent secondary brain injury during recovery. After posterior communicating artery aneurysm clipping, imaging plays an important role in immediate postoperative assessment. A non-contrast computed tomography scan is usually performed first. It gives a quick overview of the brain and helps identify early complications that may not be obvious clinically. This scan is used to detect postoperative bleeding, brain swelling, and the development of hydrocephalus. These findings can change management quickly, so early imaging is important. Time matters here. Next, vascular imaging with computed tomography angiography or digital subtraction angiography is performed to evaluate the surgical result. The main goal is to confirm that the aneurysm has been fully excluded from the circulation and that nearby vessels remain open, including the internal carotid artery, the posterior communicating artery, and the anterior choroidal artery. This step ensures both treatment success and preservation of critical blood flow. Following surgical clipping of a posterior communicating artery aneurysm, follow-up imaging is usually scheduled around day 7 after subarachnoid hemorrhage. This timing is important because it captures early postoperative changes while the patient is still in a vulnerable phase. Careful observation starts here. At this stage, imaging is mainly used to confirm that the aneurysm has been completely secured with no residual filling. It also assesses cerebral blood flow, which may be altered after hemorrhage and surgery, and checks for vasospasm, including its presence and severity. Small findings can carry major implications. Repeat imaging is not performed routinely in every case. It is reserved for situations where there is neurological deterioration or when complications are suspected, such as rebleeding, cerebral infarction, or hydrocephalus. The decision depends on clinical change rather than fixed timing. Overall, follow-up imaging acts as a bridge between surgery and recovery monitoring. It helps ensure early detection of complications and supports timely intervention when needed. Blood pressure control after surgical clipping of a posterior communicating artery aneurysm is centered on protecting the brain's blood supply. The main goal is to maintain adequate cerebral perfusion so that brain tissue continues to receive enough oxygen and nutrients during the critical postoperative period. This is a delicate balance, very important. Too low a blood pressure can reduce cerebral perfusion and lead to ischemia, especially in vulnerable brain regions already affected by subarachnoid hemorrhage. On the other hand, excessively high blood pressure can increase stress on repaired vessels and raise the risk of bleeding or hematoma formation. Both extremes are harmful, just in different ways. Targets are not fixed for every patient. They are adjusted based on clinical condition, surgical findings, and ongoing neurological status, because each case responds differently and needs close physiological tailoring rather than a single rigid threshold. Care remains dynamic. Pain control after surgical clipping of a posterior communicating artery aneurysm focuses on keeping the patient comfortable while still allowing reliable neurological monitoring. Adequate analgesia is important because uncontrolled pain can raise stress responses and interfere with recovery. Comfort matters. It is not optional. At the same time, Excessive sedation should be avoided because it can mask early neurological changes and reduce the accuracy of clinical assessment. When sedation is required, short-acting agents are preferred so that neurological status can be reassessed frequently without prolonged suppression of brain function. Balance is critical. After surgical clipping of a posterior communicating artery aneurysm, electrolyte imbalance is a frequent postoperative concern that requires close attention. One of the most common problems is low sodium levels, which can develop during the recovery period and affect neurological stability. It is a quiet but important risk, not always obvious. This drop in sodium is usually linked to two main processes. One is inappropriate antidiuretic hormone secretion, where the body retains water and dilutes sodium. The other is cerebral salt wasting, where sodium is lost excessively through the kidneys, leading to true depletion of body sodium stores. The mechanisms differ, but the result can look similar clinically. Management focuses on slow and controlled correction of sodium levels. Rapid changes are avoided because they can worsen neurological injury or trigger serious complications, such as osmotic demyelination. Correction is therefore carefully adjusted based on repeated monitoring. After surgical treatment of a posterior communicating artery aneurysm, vasospasm remains one of the most important complications to watch for, especially following subarachnoid hemorrhage. It can reduce blood flow to the brain and lead to delayed ischemia if not detected early. This risk is well known, very real. Monitoring is mainly focused on changes in neurological status. A new weakness, reduced alertness, or any subtle decline can be an early warning sign of vasospasm. Because these changes may develop gradually, frequent assessment is essential for timely recognition. Management begins with maintaining adequate hydration to support cerebral circulation. In selected cases, a more intensive approach may be used, where blood volume and blood pressure are supported while blood viscosity is reduced, aiming to improve flow through narrowed vessels. These strategies are applied carefully and under close supervision. Long-term care after surgical clipping of a posterior communicating artery aneurysm focuses on confirming stability and supporting recovery over time. Follow-up imaging is used to check the treated vessel and ensure there is no recurrence or delayed vascular complication. This phase is essential, not optional. Imaging is typically performed using computed tomography angiography or magnetic resonance angiography, depending on the clinical context and available resources. These studies help confirm continued vessel patency and long-term treatment success, especially in patients who had complex aneurysms or perioperative concerns. Rehabilitation plays a central role in recovery. Physiotherapy helps restore strength and mobility, while occupational therapy supports return to daily activities and independence. Progress is gradual, and consistency is important throughout this stage. Cognitive and functional recovery also need regular assessment, since subarachnoid hemorrhage can affect memory, attention, and overall daily performance. Monitoring these changes helps guide ongoing support and long-term planning for each patient's recovery journey. Patient education after surgical clipping of a posterior communicating artery aneurysm is focused on helping recovery continue safely outside the hospital. One key part is taking prescribed medications exactly as directed, because missed doses or irregular use can affect healing and long-term stability. Consistency is important, always. Another major focus is controlling risk factors that can affect vascular health, especially blood pressure, and avoiding smoking, which increases the risk of future vascular problems and delays recovery. These changes are not just supportive measures, they directly reduce the chance of complications over time. Patients are also taught to recognize warning signs that need urgent medical attention. Sudden severe headache, new weakness, or changes in vision should never be ignored and require immediate assessment. Early response can make a major difference. Regular follow-up visits and imaging are essential to confirm ongoing stability after surgery, and participation in rehabilitation helps restore function and independence. Recovery is a process that continues step by step. In conclusion, outcomes after surgical clipping of a posterior communicating artery aneurysm depend strongly on the quality of postoperative care in the intensive care unit, where close observation and timely intervention guide recovery. Good systems make a real difference. Simple truth. One of the most important factors is early detection of complications, because changes in neurological status or physiological instability can escalate quickly if not identified and managed in time. Alongside this, maintaining stable blood flow and continuous neurological monitoring supports brain recovery during this vulnerable period. In patients with subarachnoid hemorrhage, vasospasm remains a central concern, and active monitoring with prompt management is essential to prevent delayed ischemic injury. Over the longer term, structured follow-up ensures that recovery is sustained and complications are not missed after discharge. Finally, continued learning and engagement in neuroscience education helps strengthen clinical understanding. Stay connected with the StudyNeuro community across YouTube, Facebook, TikTok, Instagram, and X for high-yield neuroscience content and clinical insights. Thanks for watching.